In order to add the billing codes to your evaluation to be able to use them in your notes, on the treatment plan page, if I scroll down where it says recommended treatment, you click inside that box, and now you will have your list of your different CPT billing codes. You pick which codes you were doing that day and what your plan is for the future as well. So this is not just what you did that day. This is to be used for all your treatment codes that you're planning on using with the patient. Mark the codes you are planning on using so they are on your list. This is especially important if you're working with Medicare, because if you don't have the codes listed for Medicare, you will not be able to bill for them unless you would do a recertification note to add the codes at a later time. So all the codes you need to be on the list that you may possibly use, put them on your list.